Eugeria Live, brought to you by Griswold Home Care. Eugeria is a Greek word meaning health of body and mind in aging individuals. Eugeria Live is a weekly show celebrating the heroes that contribute to the Eugeria of our elderly and disabled population. Now joining us in the studio are your hosts, John Butler and Sam Grass.
Good afternoon. This is Sam Grass bringing you another Eugeria Live show. Eugeria is the state of health and well-being in our senior population. Sponsoring today's show is Griswold Home Care, which has been providing quality and vital care to our senior population for over 28 years. Co-hosting today's show is John Butler from Griswold. Welcome, John.
Thank you, Sam. It's great to be with everybody today, and I'm really pleased to be able to introduce our special guest today, Larry Robert. Larry and I have known each other and served veterans together and done a lot of work together over quite a few years. Larry is a fellow veteran. He served as a chaplain in the Navy. He is currently the bereavement services manager for Vitas Healthcare in Atlanta, and also is an accredited claims agent for the Veterans Affairs, and he is a Veterans Liaison. And so, Larry, thank you very much for being with us. Welcome.
Thank you. Great to be here.
Tell us about your organization, a little bit about you, if you like, or your organization. What would you like to highlight about your?
Well, I've worked for Vitas Healthcare of Atlanta now for over, 15 years. In that role, I started as a chaplain, hospice chaplain, and then soon, because of my background with the Navy, became the veteran liaison as well for our organization here in Atlanta. And one of my first days on the job, Paula Sanders, who's now the executive director for the Georgia Hospice and Palliative Care Organization. She was our general manager at the time. And she said, do anything that you can to help our veterans. That was her mandate. She says, it's your program as a veteran liaison, just develop a program that helps veterans. And I said, well, okay, I think that's easy enough. But what I found that veterans needed more than anything else was support with benefits. Everybody asks questions related to benefits, and it's very confusing to people, to say the least. So that's where I was able to become an accredited claims agent on my own. It's a very hard task, actually, a very difficult test. There's really nothing to really help you out there to help you with this process. But after failing the test once and taking it the second time, I finally passed. I still wake up in the middle of the night sometimes wondering, what was that one question that I missed out of 11 questions? So, because I was so sure of myself that I wasn't going to fail it this time. So that's what I've been doing now for, maybe 10 years of my 15 years with Vitas Atlanta. Healthcare of Atlanta is doing my veteran liaison stuff and working with veterans on different levels, everything from education to support to advocacy, name it, we've done it. And at Vitas, we like to say every day is Veterans Day at Vitas, and I love being a part of that mission.
You and Vitas does live that out in every way. I'm very impressed with that. Vitas is the largest hospice company in the country, I believe.
It is, yes. It's one of the largest, and it's now involved in palliative care as well. And so it's on the cutting edge of a lot of different things.
And you worked for another hospice company, I believe, before. What would you say sets Vitas apart? What's the primary thing that sets Vitas apart from other options as far as hospice is concerned?
Oh my gosh, so many things. Right off the bat, it's just, again, the education provided in literature. I can remember other hospices having to photocopy something to be able to hand to a family saying, okay, this is information on bereavement. We have so so many booklets and information related to children in grief, teens in grief, senior adults in grief, and just so many different varieties of educational pamphlets and opportunities on grief alone. So we spend a lot of money on education and being able to provide support to families and the community at large as well. We give back so much to our community in so many different ways. But I would say just the amount that we give back, either in terms of educational materials, pamphlets, and so forth, to experiences, if you will, that we provide, from everything from honor flight to virtual honor flights to just being able to support the different things that we do in the community related to veterans. And again, not just veterans, anything, again, related to education. I'm very involved with ELNIC, End of Life Nursing Education Consortium. And that consortium is, we travel nationwide to be able to educate people on the end of life needs. And now we have a specific module. There is a specific module related to veterans with that ELNIC trainer program. So it's really nice to see everything that we do in the community giving back, again, related to education and support. And right now, one of the big things that we're providing are Zoom support groups. We have Zoom support groups related to spousal loss, loss of a child, veteran support, you name it. We are now providing throughout the country all of these Zoom bereavement support groups. Now we're providing also caregiver support groups. And we also have phone-in groups, people who don't want to get on the PC and be able to do something via Zoom. We can now do it from a phone-in opportunity.
What would you say is some of the significant changes that you've had to pivot because of the pandemic? The services you provide, both palliative and hospice care, how has that changed? I know it's in probably countless ways, but what are some of the high-level ways that you have had to change how you provide your services to your?
Well, we're still going out to people's homes. We just have to now protect ourselves in order to protect our staff, ourselves, and of course the people who we're visiting at their homes. So the care remains constant, and we're committed to being able to still go out and provide that care in the community. I think as it relates to myself, I've been able to still go and provide a veteran salute, if you will, through a front porch salute now. So it's nice to be able to go ahead and leave on the front door of the patient a flag pin, a lap blanket, a certificate of appreciation, and then stand back, watch them come and take it, open up the lap blanket, and just admire all the little things that show that they're appreciated, and being able to salute them for their service and they salute me back right on the front porch is pretty amazing. So we've been unique in being able to work around the different needs, and so it hasn't stopped us, it's made us better.
Larry, that's been really good information. I really appreciate it. Is there something that you can think of that you would like to share with the audience that's kind of a one thing you want to leave us with about what you do, or about Vitas, or just what in general? What is one thing you would like to leave us with?
Well, as a chaplain, when I tell people I work for hospice, the one thing that many people respond with is, wow, that's probably a really tough job, and that how can you do something like that? That must take a big person to be able to do the job that you do. But if I could communicate one thing, it would be that when you're working with people who are dying, it's not the negative experience that one would think it is. It is a very powerful experience to work with someone who is dying and to share their story with them, to walk their walk, to experience their journey from their standpoint. And that's what hospice does. When someone is dying, when you're working with someone at the end of life, you're dealing with someone sharing their life story. It's called life review. And in that review, you become a part of their lives in a very special way. So you don't have this constant focus on dying, but you have a celebration of life that is shared, not only with that patient, but with the family and with myself as well. And other hospice workers can attest to that as well, that when you work with the dying, you are sharing a special sacred part of their life that is very fulfilling to them and very joyous to us to be able to share someone's life in this very meaningful and powerful way. It's hard to express, but once experienced, it makes my job something that I really look forward to day in and day out. It's not this negative experience or depressing job that some people may think it is. No, it's the opposite. It's sharing life, and in sharing life, we share each other's joys and sorrows. But ultimately, in sharing the sorrow and the pain, you're able to relate to someone in this very special way to be able to experience the joy, the other side of the coin. So it's been a very powerful experience to have been and to continue to be a hospice chaplain and working with veterans, just from the mere point of being able to share their story, share their journey, and be able to let them know, job well done.
Great. That's very insightful, very helpful. Thank you so much. Look forward to seeing you again soon. Thanks again.
Okay.
Thank you, Larry.
Eugeria Live is brought to you by Griswold Home Care. View this show again on YouTube, Facebook, LinkedIn, or our website at www.eugerialive.com.